Hi guys, this week's lecture is going to be on autonomics, autonomic drugs, and the effect under anesthesia, and how we really use them. So here are some of the objectives. So really, what you guys do every day in practice, that's autonomic medicine. From the time you see the patient, you calm them down, sympathetic effect, give them drugs, sympathetics, patient has a vagal reaction during a laparoscopy, you're working with the parasympathetic. During the entire time, you're modulating these responses, and you'll notice. So let's start by talking about some functional anatomy of autonomic nervous system. So you have your brain, you have your spinal cord, and you have two major divisions of sensory and motor divisions. Now, the sensory division is the part that comes from your body and goes to your brain. Quite simply put, has a somatic part, feeling the touch, pain, those kind of things, and visceral sensation. So the stomach getting kind of stretched, the chemical changes, nausea, hunger, all those things. So those go to the peripheral nervous system and then eventually to central nervous system. And the efferent part comes from the brain, goes through the peripheral nervous system to get to the motor function eventually. And this can be a somatic motor, like moving a muscle, skeletal muscle, or visceral motor, like affecting blood pressure, heart rate, and visceral motor division is broken down into parasympathetic and sympathetic division. And this is the core of this lecture today. So, anatomy of autonomic nervous system. You have the central nervous system, and that's going to give rise to the preganglionic neurons in the peripheral nervous system. They're going to go and synapse in an autonomic ganglion, and then the second neuron is going to be the postganglionic neuron, and that's going to go to the effector cell. So autonomic ganglia and the effector cell. Two divisions, sympathetic, parasympathetic again. Now, let's focus on the sympathetic nervous system first. So, you have the postganglionic sympathetic neurons that originate under either the parasympathetic ganglia, so postganglionic neuron comes from the autonomic ganglia. You have the parasympathetic ganglia that they originate from. Can be either the parasympathetic ganglia or unpaired the collateral plexus. Now, what is sympathetic ganglia? So, you have the thoracolumbar division, you have the preganglionic neurons originate from the T1 through L2, and the sympathetic ganglia. You have the sympathetic trunk or vertebral chain ganglia, prevertebral or collateral ganglia, and these are celiac, superior mesenteric, inferior mesenteric, aorticorenal, and the renal ganglia. What about adrenal medulla? So, as you know, it's a major organ of sympathetic nervous system. Secretes primarily epinephrine and a little bit of norepinephrine directly to the blood when stimulated, and stimulated to secrete by the preganglionic sympathetic fibers. So it really acts as a as a synapse of a postganglionic neuron. Oops. Yep. So what about parasympathetic division? So this graph, the left side talks about is the parasympathetic, and the right side is the sympathetic division. You have the preganglionic fibers that pass directly to the organ that they innervate. So you have just the presynaptic fibers going directly to the ganglia that's on or very near the organ they want to innervate. The postganglionic cell bodies are just near the innervated viscera. So this results in a limited distribution of the parasympathetic postganglionic fibers, so they have discrete and limited effect. And this is different from sympathetics. So let's talk about the preganglionic fibers of the parasympathetic nervous system. Their cell bodies originate in the brain, brainstem, sacral segment of the spinal cord, and their preganglionic fibers are in the cranial nerves 3, 7, 9, and 10, and also the sacral outflow. Again, graphically, you see the cranial nerves on top and the sacral outflow in the bottom for the peripheral nervous system. Putting them all together, somatic nervous system, autonomic nervous system. Somatics start from the central nervous system, go to the peripheral, and they eventually go to an effector organ to do something. The sensory part, the autonomic sympathetic division. Note that acetylcholine is the universal presynaptic neurotransmitter. They go to the ganglia or adrenal medulla, and then they go through the postsynaptic neuron and release their neurotransmitter, and primarily norepinephrine in terms of sympathetic nervous system. When it comes to affecting blood vessel, it's epi and norepinephrine. Then you have the parasympathetics. Acetylcholine again as the neurotransmitter of the preganglionic cell. You go to the ganglia, and then you have the postganglionic cell that releases acetylcholine when it comes to parasympathetic division. So if somebody asks you, what is the neurotransmitter that's released in a from the preganglionic neuron? Doesn't matter what the neuron is. Could be somatic, sympathetic, parasympathetic. The answer is acetylcholine. Now, if you talk about the postganglionic neurotransmitter, it's going to be, norepinephrine, primarily when it comes to sympathetic nervous system, and when it comes to parasympathetic, it's going to be primarily acetylcholine. Of course, there are some exceptions that we'll talk about in a bit. Now, some anatomic differences between the sympathetic and parasympathetic. So, length of the postganglionic fibers. Sympathetics have long postganglionic fibers. Parasympathetic have short postganglionic fibers. Remember, the ganglia for parasympathetic was right near the organ, so the postganglionic fibers are going to be short for parasympathetic. Branching of the axon. The sympathetic axons are highly branched, so that means they influence many organs. That's why when you give epinephrine, it's not just one or two organs that's affected. Many organs are affected. It's going to be your blood vessel, it's going to be your heart, it's going to be your kidney, it's going to be your liver, your metabolism, all that stuff. Parasympathetic axons have few branches, so they have a much more localized effect. So when you give glycopyrrolate, what does it do? Primarily affects the heart, does a little bit of other things, but that's the primary effect. Again, looking at this graphically, you have we're comparing sympathetic in blue to parasympathetic in red if you look at the arrows. So first things you notice is the preganglionic neurons for parasympathetic are very long. So preganglionic. Parasympathetic in red are long, sympathetics are short. And if you see, the ganglia for parasympathetic is much farther compared to sympathetics that's pretty close to the spinal cord. The postganglionic fibers for parasympathetic are short, for sympathetics are long. The branching pattern, you see, for parasympathetic in red, very localized effect. For sympathetic, very diffuse effect. So now let's move on to the transmission in the autonomic nervous system. So action potential comes to the synaptic cleft, and this results in release of a neurotransmitter. Pretty straightforward. This neurotransmitter interacts with the receptor on the end organ to do something, to evoke a potential, a response. The preganglionic neurons of both systems release acetylcholine. This is a key point. You're going to be asked about this in multiple test questions. The terminals of the parasympathetic postganglionic fibers release acetylcholine. So for parasympathetic, it's acetylcholine throughout. But the terminals of the sympathetic postganglionic fibers primarily release norepinephrine. But a major exception that's commonly tested on are the sweat glands. So sweat glands, the sympathetic innervation of them, the neurotransmitter is acetylcholine also. So remember that. And the rate of the synthesis of the neurotransmitter depends on the level of the autonomic nervous system activity. and it's regulated by local effect. It's not, from hormonal effect. It's really local effects. So for sympathetics, epinephrine and norepinephrine are the main mediator of the peripheral sympathetic activity. Norepinephrine is released from localized presynaptic vesicles of nearly every postganglionic sympathetic nerves. And again, here we're talking about the localized release in the synaptic vesicle, synaptic cleft. Not talking about the systemic norepinephrine. The sympathetic nervous system that end in the medulla, in the adrenal medulla, are preganglionic. So adrenal medulla is kind of like a sympathetic ganglia turning into an effector organ. So these fibers that go to the adrenal medulla, they actually stimulate the adrenal medulla with acetylcholine.